meeting of the July 1st, 4 o'clock regular hospital authority meeting to order. July 31st. The first meeting of, well, technically my first meeting, but this is July 1st. We'll start out by allowing anyone to disclose a conflict of interest. Seeing none, we'll move on to the next item, which Dr. Miller will go back to you and say, would you please read the mission statement?
The mission of this hospital is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. Our vision is leader in exceptional community health care, one neighbor at a time.
Thank you. Next item on the agenda is public comment.
There are none.
Okay, thank you. Up next is the minutes. Everyone has had a chance to read the meeting minutes for June 26th. I will accept a motion for approval. Is there a second? Any discussion? All in favor? Aye. Motion passes. Next item on the agenda, Mr. Esquivel, the PSA update, and Mrs. Lewis.
I will start, and Ms. Lewis, I think, can give more details, or Dr. Elders. We had hoped to have an agreement for the board's approval at this meeting, and we have been slightly delayed, but not by much. We have the short story is that the lawyers are looking at it more carefully, and Metro Legal has brought in some technical expertise to take a look at the PSA, and counsel for the hospital, counsel that has been engaged by Metropolitan government, and counsel for Meharry are reviewing the agreement and making some revisions. I don't understand them to be revisions that are controversial or are going to interfere with the thrust of the agreement, but that is the reason why we had thought this would be ready for us this month, but we are very confident that at our meeting in August we will have a final agreement that the lawyers have all signed off on, and that they'll be acceptable to both Meharry and to the hospital. And ask Dr. Elders for further insight on that.
Sure, just to add a little more color, the PSA committee had completed the work, but for the hospital, we have to have approval from the Hospital Authority Board. And so we have our legal representation, the Hospital Authority Board has their legal representation, and Meharry has their representation. And those three entities, from my understanding, are just working out a few language clarity items. And we've been told that it will be probably within the next week or so, but we are very hopeful that we'll have it ready by the August board meeting. You want to say anything? Christy?
Yes. Is there a way that the board could be aware of the general principles that are in the agreement, so that if anybody on the board felt the need to have any input, it could maybe be before we were asked to approve it?
The plan is, once the draft is approved by all the entities, you would receive it 10 days prior to the board meeting for review, and then we could make those deliberations and comments here at the meeting. That's my understanding of the process. Christy?
Yes, ma'am. Thank you. That is my understanding as well, is that it should be ready for the August meeting in the presentation, and that it will be submitted to board members for review before it is formally permitted at the August meeting.
Maybe our attorney or board attorney, Derek Smith, could just speak to maybe the appropriate pathway should you, Dr. Martin, have any comments to make to get it to the right committee member once you have had an opportunity to read that. We've normally sent things to Janet Lester to then disseminate, but Mr. Smith, if you have a comment.
Go to Janet, but then from there, before it comes to the committee, it probably should come at that point through your interim director, to avoid just an exchange between Dr. Martin to Janet, and then from Janet to, I'm going to pick on David, but straight to David. I'm not comfortable with that. I think, especially if it's comments that might be construed as deliberative towards the PSA, I think it should be brought to the attention of the committee at its open meeting through staff members. But any board member at any time is allowed to communicate to hospital staff members. So that's what I would recommend.
Yeah, it just seems like if there's any changes that anybody on the board might want to suggest, and they can't do it until the next board meeting, then that could delay the adoption of the document for a month.
What we'll do is get the document out as soon as we haven't sent it out to all, in its various drafts, as it's not completely finalized. So once it's finalized, we'll get that to the board as soon as possible. But we have been very hesitant in circulating drafts that weren't official yet. When we announced it at the June board meeting, I believe, the committee work had been completed. So we had a PSA committee, which isn't an open meeting. It was just a committee, and Councilor Esquivel sat on that committee with us. Councilor Esquivel sat on that committee with us in collaboration with our Meharry partners, and we worked through the, meat of that agreement. And then now we have sent it to our legal entities for their suggestions. And then it would go to the board. So we were as soon as we get a final draft, we're happy to send that to you all for your consideration.
Yes.
So with that clarity about the committee is more of a working group, not a true board committee, I still recommend that board members communicate to staff if they have questions or concerns about the proposed PSA, and hopefully there'll be sufficient time to address that. But the only way I think that the board could truly, in a deliberative and voting mechanism, make changes would be through your processes here in this meeting. I don't see any other way to do that.
No, I certainly agree with that. It would just be nice to have a summary of the highlights, principles, of the agreement.
Well, once the agreement is finalized pending board approval and pending Meharry's approval, I think when we send it out, we could give an executive summary, and maybe would be helpful if that would be appropriate and given the importance of the agreement. So I'd be happy to work with you and do that, and you all are in the best position to give the executive summary, but we will do that.
Thank you. Next item on the agenda is new business is a conflict of interest. Ms. Lewis.
Thank you, Madam Chair. All of the board members have received the conflict of interest for the 2025-2026 term. And so please turn them in to Ms. Janet Lester or to me today if you have them today. This is a part of our governance and also compliance requirements for having an annual conflict of interest for the board as well as for the body for Nashville General Hospital. The policy has already been approved in the 2024-2025 term. So are there any questions regarding the disclosure? If there are none, then please, I will collect them from Ms. Lester and from individuals today if you have them present. Thank you.
Thank you for your work, and going forward, that will be an annual signing, so expect that again next July. Next item is the committee assignment. So you should have a legal piece of paper, landscape, beside you that has your name listed as well as the committees that are available currently through our hospital board. Some of our committees only require one participant, as they are more of a liaison and or a participant to a bigger process, and not part of our bylaws requirements. We have a few that are actually bylaw requirements, such as finance, nominating, and compliance and audit. We have a new committee, our Engagement and Advancement Committee, that has been developed for this year. So the challenge was really to assign individuals to committees based on, again, hopefully your interest level, and then also make sure that we have enough members for the committee, and then be able to facilitate a quorum for ease of decision making. We do have now 3 vacancies in our board, so I'd ask that you be a little patient with me. Sometimes when you see the end number that says total committees, don't be a little shocked. First of all, some of you signed up for those, but secondly, more importantly, it is a challenge when you have less members of the board to assign to a committee. So as we have more people who come onto the board and we recognize their strengths, weaknesses, and then also more importantly, their interest, I'd like to have the flexibility to evolve this document. So I had put in the document as well, finance, I believe it should be meeting monthly. We have a lot going on. It's an important committee. Our CEO, Performance and Church Committee, is, as stated, monthly, but, we sometimes have delays in that. Our compliance and audit, I'd said, is quarterly. Nominating committee, really once or twice a year. And then we have quality, medical staff credentials, bylaws, and are all just one person, and a virtual meeting, and then the PSA, which is currently a little bit more rigor. But going forward, I do see that as a slot that someone would fulfill in this partnership with Meharry to make sure that there's still a contact and touch point for that area. So please let me know if you have any questions or you want to shift. Again, I think it just will be a work in progress a little bit, but we do need to approve the committees. So are there any questions or any comments or any concerns about the Excel spreadsheet? I did also, for this year, create a chair. It doesn't have to be the person that I put on there, but I wanted to spread the love equally and obviously give people a chance at holding a leadership position and allowing that the work not to be dumped just on one person. So I did divide those duties up as well. So we'll let each of the chair people work with Ms. Lester in terms of engagement and scheduling. I think as it might be some preferences for people who are on multiple committees, especially if you're meeting, to do them all on one day or have a day that you did back to back. So you don't have to, because they're in person, come multiple times a day. Multiple times in a month. So those can all be arranged. But that being said, do I have a motion to approve the committee assignments for fiscal year 26?
Moved.
Is there a second? Any discussion? All in favor? Aye. Motion passes. Thank you, everyone, for your new level of engagement and leadership. I appreciate it. I understand what it is to lead a committee and the work that's put in. So thank you in advance. Next item on the agenda is Centurion contract. Is there any comments or deliberation? Seeing none. Next item on the agenda is a marketing report. Mrs. Kathy Poole.
Good afternoon, everyone. Janet had something in your packet, but then I also added something to the very back of your pile of papers earlier today. So for the marketing report, we're really focusing on community outreach events that we've done this year. The first thing that you will see is all the community engagement activities we have going on broken out whether it's community outreach, referral networking, sponsorships. I've included our congregational health and education network events that are upcoming, our Medicare population outreach, and then also Metro and Metro Nashville Public School Health Incentive Program outreach. And then this map that I've included, kind of color-coded to go with this, but shows that we're not in one area of Nashville, that we're really expanded into Nashville as a whole, and you can pretty much put our patient population heat map right over this and see that we are mainly North Nashville, Southeast Davidson County, and then also up toward the Madison area with our community engagement. If you can go back to the slide before, I'm so sorry. Thank you. And then a couple of updates for our division. I'd like to recognize our new patient experience manager, Ms. Stephanie Kennedy. I am very excited to have her join the team. She has a wealth of experience in patient experience, but also in Nashville General Hospital. So we are grateful to have her on board. And then also when it comes to crisis communications and public affairs, Ms. Smith had reached out to a couple of companies over the last few months. As you know, we have not decided to do an RFP for this year. We're probably level setting right now, and especially with the advancement committee that's the board is going to be has established. But what we have done is we recognize we still needed help with some PR crisis communication, and we are working with Finn Partners. They have history with us. They are also connected to Meharry as well as with Metro. So the relationship is very important, especially as we're working forward with the PSA. And then, of course, this last week, there's been a lot of conversation that has taken place and really needed them. So I appreciate our board chair's support in moving forward with them. And then we also have had some conversations with another company called Gerard, and with the newly established committee, we'll be bringing them to the table and seeing, is this how we want to move forward? You know, what other companies are out there, but then looking at the movement through this next fiscal year before we do a full RFP for marketing, communications, and government relations. Outside of this week's media, we've done a couple of press releases over the last month. Dr. Adedokun, one of our surgeons, did make Nashville's top doctor list. We have a new provider, Dr. Brandon Allen, in the Bordeaux area. Blue light, Josh left. Something new for bladder cancer in the OR. Thank you very much, non-clinical. And then the search firm for the CEO search RFP went out, and our selection of new hospital authority board members. I put Invest Nashville in italics because that's something we're working on. They've interviewed Dr. Elders, and we'll be interviewing Ms. Smith for a piece on that. And then the next upcoming event for the hospital is our School of Health Sciences graduation. That will be in September, so more to come next month on that event. Yes, sir.
Did I miss any mention of a little newspaper story yesterday in which we were mentioned?
You did. Thank you for reminding me. I did send that out. So Nashville General Hospital was part of the bigger story about U.S. News top hospitals. So congratulations to the staff here. And we'll be pushing that out on socials and everything else this next week. So thank you for that. Any other questions? Thank you.
Thank you very much. Our foundation report, Mr. Lesser.
I'm going to ask Kate to come and send a message to everyone and say a few words, and then I'll fill in at the end of her presentation.
Good afternoon, everyone. I just wanted to start by saying that we had an amazing meeting yesterday with our board and Veronica and Mozetta, Dr. Brown. We had a very insightful meeting. It was energetic. We had a lot of amazing, wonderful ideas. And so I'm very excited that we have new board members that have a synergy to actually be able to lift the foundation and the hospital up. So it was an amazing, amazing meeting, and I thank those that were there yesterday. Let me start by saying also that last year the foundation raised $300,015,577. So that is not exactly what we want to raise. We want to get that up. But with all the changes, I say that's a pretty good amount of money that we raised with everything that has been going on. Our community impact, the food pharmacy has already provided over 1 million meals since inception. And this year they provided 167,000 meals just this year alone. And I wanted to say also that yesterday we got some really good news. Our board member, Jason Martin, has partnered with someone, and actually it's one of the people that run Bridge Builders, and we will be getting funding for the food pharmacy for the rest of the year from them. Very, very exciting. That is one of the things that we are constantly trying to raise money for, because we spend the money for the food, and so it is a constant. So we're always working on something to help raise money for that. We had 2,500 patient rides since the golf cart has been here. 2,500 rides. That's really amazing for our patients. Those patients that cannot walk from the garage to the hospital, this has been a godsend for them. And we're really excited about how many people are actually taking the opportunity to ride. Our Chad van this past year did 500 rides. Bridge Builders, and I want to say this, Lisa and Ashley are sitting in the back, and Dr. Bullock. Bridge Builders is one of our partners. They have been instrumental in providing backpacks for our unhoused community in the ER. They've provided shoes. They've provided toys for children that are in the ER. If they come into the ER, they provided toys. They are one of our greatest partners. They have been instrumental in making a difference in people's lives. And I want to give kudos to the ER staff too for working very hard to make sure that our people are taken care of. This year we had several grant requests that are out. I have a Kroger grant request for the food pharmacy, $25,000. And the ones I'm saying up front, we have not heard from yet. So they're still being looked at. We have an Ingram Industries and Nashville Soccer Club grant out, and that's $20,000 for the food pharmacy. I have sent a grant to Tony Robbins Foundation for the food pharmacy. They match what we also our pillar about taking care of people in food. And the Cliff Foundation, same thing, $25,000. We got 2 notifications back, one from Bank of America and one for the Women's Fund for the SANE group, and we did not get either one of those. Okay. Our fundraising activities, of course, some of you came to the Tater Tot fundraising event, and that was for the SANE program. They actually raised $3,700. And I just give kudos to those ladies and everybody that showed up for the first event. That was amazing. Really, really good. Lots and lots of donations. We were very excited about that. We also had the Pastors United in Praise event at the Hopewell Baptist Church they raised $3,000 through love offerings. So just somebody giving an offering out of the goodness of their heart. That was an amazing event. Veronica was there. I'm sorry, Dr. Elders was there. It was very fun. And they are doing it again. So it's going to be an annual event. Of course, then our all-weather wellness, and I'm going to give a pitch to that. That is a program that is really important to us, and it's really important to our patients. We need help getting certain things for our patients to wear. Our unhoused, people that walk in, they may walk in and that we need to take their clothes. And we want to make sure we're giving something back. We don't want to send them home in paper scrubs. We had 3 new members to the board, and we're very excited about that. Craig Lesser, Spencer Mullins, and Jason Martin. And we are getting ready. Our chair has retired, and we're getting ready to look at that. Volunteers, we had 108 volunteers with 2,500 hours provided. So we had a great influx of volunteers. And then we are going to start our employee campaign, and we'll start that in September. And I will get with Kathy to make sure we're not having events all at the same time. But we're going to do a lot of what we did last year, where we had the cafe, and we also are going to do karaoke. So be looking for that. It will come to you in your email. And that, last year we raised $30,000 from the staff. So I say that was a really good fundraiser. So any questions?
Kate, thank you very much for that report.
You're welcome.
Let me just add 2 things, and we can segue into one of the important things, and that's a request. And I made this request yesterday of our board when we met. Every board member on the foundation needs to be a contributor. And not everybody can contribute big dollars. That's okay, but at least a minimum amount, because when we go to other foundations, and ask for money, they want to know if the leadership is excuse me, I get all choked up asking for money. They want to know that the leadership is 100% on board. And that's a financial commitment. I'm going to ask the same here. The July 1st has come and gone, so we are in the new fiscal year, and I'm going to ask all of our board members to consider making their contributions as quickly as possible. As early as possible in the fiscal year is always helpful to get our programs moving. The next thing on top of that is that this is a real turnaround. Just like there has been a real turnaround in the last few months here at the hospital, there's a real turnaround with the foundation. And Kate, thank you for the work you're doing and your staff.
You're welcome.
There was an incredible amount of enthusiasm. But the most important thing, I think, right now is the alignment of the hospital leadership's determination of need here in the hospital to better serve our patients, aligning that with the foundation so that the foundation is supporting those priorities as presented from the hospital. And there were no questions asked about that yesterday. Not only is it important now for the first time, or at least in recent memory, now that we have a member of our authority on the board of the foundation, but we've also suggested 2 additional board members from the hospital so that there's a working alignment, and it's not just a request that would come in once or twice or 3 times a year. Working together to make sure that we are not only in alignment, but creating the basis to ask for significant dollars from significant sources in a way that maybe we haven't done in a very, very long time, if at all. So with that, Madam Chair, thank you for the time.
Thank you.
Thank you very much.
Ask a question. So as you go to donors asking for significant contributions. Do you think it would help to have a target for how you would use that contribution? So, for example, have a specific project at the hospital that we want to fund.
Sure, and that's the idea behind having a list of priorities with dollar amounts associated with how much those priorities are going to cost. And I'm happy to tell you that having asked Dr. Elders to get that report done yesterday, I saw that priority list. So we are well on our way to that movement in that direction. So thank you for that, Dr. Miller.
Thank you. Thank you for that report. And we'll look forward to more reports and lots of progress. I'm sure there's an easy way to donate, Mr. Lesser. So if that's a website link or a QR code, make sure that Ms. Lester gets that, and so she can distribute that to all of us. Okay.
Kate will take care of that before the day is out.
How fortuitous for all of us. Okay, everybody,
Just
get
so
their
you know,
phones
I've
ready.
made my contribution already.
Thank you so much. All right, next up is medical staff reports. Dr. Bullock.
Good afternoon. I'll be giving the bylaws report. I am happy to report that the Medical Staff Bylaws Committee has submitted a final draft to our legal for review as of 2 days ago. That will be reviewed by the lawyer, and then we hope to have about a 30-day turnaround. Hopefully it will be available for us to present for vote at the next MEC. Once MEC approves it, it will go to the medical staff annual dinner September 24th for full vote by the medical staff. So that is my report for the Bylaws Committee. Does anybody have any questions? Thank you.
Next on the up is the quality report. Dr. Lewis and Ms. Denson.
Good afternoon. I'm not going to spend a lot of time today on the quality report because I want to hit on our top 3 safety wins as a whole, and then our top 3 opportunities and what we're doing as an organization to move the needle on those. Our top 3 safety wins include we have gone now 3 consecutive months without having a fall with injury, which is huge. We had an event back in April. The organization as a whole formed a multidisciplinary team to take a real intense look on what led to that particular fall with injury, and now we've gone 3 consecutive months without an event. Our second win is our C-section utilization. I know the last couple of board meetings I spoke around some of the issues we were having with coding for clinical appropriateness and things of that nature. And for the first time in the last 3 months, we have met that goal as well. And you can see the outcome in your meeting packet. The third safety win that we had is around regulatory readiness. I know at several of our past board meetings, I've spoken about unannounced survey visits that we've had, just like any other organization has from time to time. But I'm happy to report that from our May 15, 2025 Emergency Department PEDS Assessment Survey, we were cleared of any deficiencies, have now returned back to full compliance as an organization and establishing helipad access with Metro Fire Department assisting. And then we also had an unannounced survey visit on July the 22nd. This was due to a security complaint that the Tennessee Department of Health had received in their office. And I'm happy to report that no deficiencies were noted in that particular survey. Many thanks. I see a lot of people that were involved in that survey. Ashley from the emergency department was involved. Jerry Galoo with our facilities security team. Dr. Elders and Dr. Brown were also involved in supporting our quality and patient safety team on that as well. We received high commendations from the surveyor in our efforts as an organization to identify risk as far as safety and security, but also too, we've since had a more aggressive effort in installing proactive measures to reduce the likelihood of a safety event in the future. And as I stated, there were no findings for that survey. Now on to our top 3 opportunities. I know I've talked at length around hand hygiene, and that has remained an opportunity around hand hygiene adherence. We have yet as an organization to get to our 95% goal, and I'm going to discuss very briefly some of the action items that are in place. One, we will continue to encourage our observers to coach in the moment when non-adherence is noted, but what we're moving to is to try to establish some type of code phrase so that when we coach individuals, you're not just blatantly saying, hey, you didn't wash your hands. We have talked about this in our infection control committee and quality committee and how we're going to roll this out as an organization. So hopefully by the next meeting, we'll have some updates on where that stands. And then also, if you've been in our facility, you notice with our hand hygiene dispensers, we have signage above those dispensers, but the company that we purchased from do allow us to rotate signs. And we know when you leave signs there for a long period of time, they become part of the geography in the hospital. So we're going to have a more concerted effort to rotate signage to draw staff members' attention to the dispenser to engage with it to do hand hygiene. Second opportunity is around reducing the overall incidence of falls. We haven't had a fall with injury in several months, but we have continued to have fall incidents. So our falls prevention committee has continued to work aggressively in doing proactive bundle audits to make sure that we're addressing gaps in our processes as an organization. We're escalating findings to our leaders and our care teams to make sure that we're focusing on education and support for them as well. And then also, too, our nursing team is committed to increasing adherence to purposeful hourly rounding with our patients. And last, but certainly not least, we have refocused efforts in reducing overall workplace violence incidents. Many acute care organizations and other healthcare organizations have experienced a concerning trend and increases in workplace violence incidences. And Dr. Brown has worked with our facilities and security team to reinstitute our workplace violence committee. We have our first meeting on tomorrow. It's a multidisciplinary group that includes quality, safety, HR. There's clinical staff that are involved too as well. But we have, like I said, noticed a lot of safety events involving aggressive patients and want to make sure that we're doing our due diligence to protect our staff. Also, quality, risk, and compliance are proactively addressing repeat incidences. When we see that a patient has repeatedly distributed violent behavior to our staff, and we are following through on internal policies that at times we've had to make tough decisions to terminate services when appropriate too as well. And then also, too, we're assessing our HR and security processes to ensure that going forward that we're following through and ensuring that we're keeping our staff as safe as possible. Now I'll open up to any questions that you might have. Okay, thank you so much.
All right. Thank you for your report. We will need a motion to approve the quality report. Do I have a motion to approve? Is there a second? Any discussion? All in favor? Aye. Motion passes. Next up is a committee report. And that's me. So the first one is this CEO Performance Review Committee. And we met earlier today to review the final draft that our team has been working on, our committee. This has been, as one committee member stated, it's been a long time coming to get to the point where we are in this report. The goal is to have this to continue to evolve and be better. But there's been a couple key changes with some kind of merging of categories. We merged the quality and customer service category into one, as well as created a new category called employee excellence. Our committee believes in the individuals who help run this hospital and want to make sure that part of the CEO's goals are focused on employee excellence and maintaining and creating that culture. So we believe that having a separate category for that will be important. We also talked about areas in growth with planning, proactively, both with technology and innovation, and making sure that the innovations that we have invested in are paying off, as well as with regard to promoting and expanding healthcare programs and diabetes prevention and heart healthy initiatives, using our Press Ganey engagement results with both employees, physicians, and our leapfrog score. So we're still using some of the original language, but definitely expanding those, putting some real teeth to the numbers with regard to our audits, our net patient revenue numbers, our clinical visits, and then obviously to making sure that we maintain and keep talent. We've added a category, it was a goal and measurement criteria around the completion of a compensation analysis. So again, wanting to make sure that we are, as a board, continuing to push our executive leadership team and the hospital to make sure people are fairly compensated, and we are providing best care. And the last area is board member and stakeholder relationships. I think that speaks for itself. I've seen the marketing report engagement obviously grow and expand in Davidson County, but this also puts some specific measurement criteria around those relationships and even partnership with the hospital foundation. So any other additions or comments by our committee members?
Just a quick comment to thank you, Madam Chair, for your hard work on this, because you really got into the details on this, as you do on so many other things here, and that's much appreciated. Also to thank Dr. Elders for your engagement in it and input, and of course Janet for all the work you do to make sure that this all comes out right. I think we have to put this in context, though, and realize that in recent months, as a result of lack of diligence, if you will, on part of previous boards, we were 2.5 years behind in doing a CEO assessment. And it's now late July of the new fiscal year, but we're caught up, assuming that this board approves the work that's been done. And I just want to thank you, Madam Chair, for your leadership in this. This was a lot of work, but I think it's in our best interests as we move forward, and it's in the best interests of our interim CEO and whatever happens in the future. And it is going to be flexible, because we'll be looking at it again to make sure a year from now that we're doing the right thing with the kind of feedback that we get at that point. So I think we've made a lot of progress, and happy to be a part of that team. Thank you.
Thank you. And on a side note, tying back to original bullet point, the CEO Performance Committee has been a standalone committee, but going forward, since the CEO Search Committee, kind of an ad hoc committee has been created for the need, that will cease to exist after a period of time when we finally engage and hire our CEO. So these committees will be combined and condensed to one. I feel like that it's a natural synergy between those committees, and being able to communicate what's expected to a new CEO. Our final CEO will be very much needed, and I think that's the best marriage there.
Madam Chair, I'd like to echo everything that Craig's said. This is a vast improvement. Took a lot of work and is much more meaningful and specific now. In terms of when CEO evaluation is done, do we plan to do any for fiscal 25, or will the next one be a year from now?
So the fiscal 25 we just did, so we closed that out under Dr. Webb's assessment in our last meeting, even though he didn't complete the full
Right.
fiscal year. So we did not create a separate kind of short-term assessment either for the interim CEO's position during that short couple months, and then have not specifically decided to do, there's not been direction specifically around doing this process for an interim. We definitely want to make sure this was, ready to hand to the CEO once that he or she has decided going forward for fiscal year 26. We wanted to make sure that this piece was as ready as we could be to hand over.
Thank you. And I'd like to move approval.
Thank you. Is there a second? Second. Any discussion? All in favor? Aye. Motion passes. Thank you. Next up, CEO Search Committee, Dr. Esquivel.
Thank you very much, Madam Chair. We are in the midst of the selection process of a search firm to assist us in our search for the next CEO. That is a public procurement process that is underway. So the update is that the deadline for firms to submit their bids to be selected or for consideration was July 24. That period closed. We had 10 firms who have submitted bids, which I think is good news. That's a lot of interest in serving, and so we have not seen those yet. The next step in the process, which is being run by Metro's procurement division, is to circulate those 10 proposals to the evaluation committee, which is a small group of hospital leadership employees. I'm going to serve as the board's representative on that committee, and we will go through the process of scoring and evaluating, interviewing a certain number of the candidate firms, and then recommending to the committee and ultimately this board a firm to proceed with in the CEO search. So the timeline, Metro Procurement has not given us a timeline for that. I'm told that we could reasonably expect next week to receive the actual proposals and begin our review, and we'll have a further update at the next board meeting. But that process is underway, and I think it's encouraging that we have so many firms that are interested in assisting us with this search. I guess the other note as a reminder is that this search process is to engage a firm not just for their first order of business will be to assist in a CEO search, but they will be on retainer, so to speak, to be used for executive level searches as they are needed in the future.
Is the evaluation committee established?
It is, my understanding, is under review by Metro Procurement. We've proposed a group of people, and so the procurement professionals are making sure that we have coverage. This is all people who are affiliated with the hospital. There's not the substantive expertise and roles within the hospital, not dedicated procurement people. Metro is facilitating that process, but the identity of that committee has not yet been finalized.
All right. Next up is the finance committee report. So, Dr. Blackledge.
Hello, everyone. Just going to focus on a few small items. I'm going to focus on the current month performance for June. On the income statement for the current month, if you are following along there on the top, the total patient revenue You can see it's $24,256,000. That is compared to a budget of $28,148,000. And while that is, well under budget, about 13.8%, if you look over, keep going to the right there, you can see that it's compared to prior year is up 4.7% compared to prior year. So heading in the right direction there. And then going down to the next couple of sections there under additional state funding and the city subsidy. Specifically the city subsidy, you can see is $11,582,000 compared to a budget of $4,962,000. That is primarily due to receiving the rest of our subsidy, along with funding for the Meharry lease of $6.6 million. So that is revenue that's associated with going down into expenses under leases and utilities that show $8,103,000. That is where that lease hits, along with the next item under interest. There's $1.3 million associated with interest with that lease, which is $5.3 million. And then also going back up a little bit on the expenses under salaries, $5,404,000 on the first line of expenses compared to a budget of $5,035,000. That's $368,000 over budget, but it is kind of trending downward, kind of to where we need to be, which is of course on budget. There's some severance and some other payouts in this past month, so we should see that number come down going into July and forward. Any questions about the income statement?
So looking at year to date, which is basically the last completed fiscal year.
Correct.
And leases and utilities are 11 million more than budgeted.
Yes.
I don't quite understand.
Yes, that's a very good question, and that is, I would say that was a budgeting issue. So the Meharry lease was not included in that budget, so that's a big part of it. And there's also some costs associated with the Cerner conversion that were not included in the budget as well. Those are the primary drivers of that number.
Okay,
being
thank
so
you.
far over. Mm-hmm.
And also, the year-to-date operating margin and net deficit are much lower in this report than they have been in previous months. The operating margin, for example, a couple of months ago was like negative 26 million. So this looks a whole lot better. How did we get to that?
Yes, it has to do a good bit with the timing of the subsidy. We received $6.4 million of the subsidy in the current month, which was almost $1 million over budget what we expect, along with the Meharry lease, that funding of that expense, which is $6.6 million total.
So the supplemental funds from Metro, is that what?
That's just part of our regular subsidy. And so it was the timing of the receipt of that. That's my understanding. Yeah.
Ray, I hope you don't mind me joining you here, but I'll join Ray in responding to that question. But part of the ask is around the $9 million supplemental. So that supplemental is included. It is looked at as revenue or income. So that did help settle some of the $26 million that you remember probably. I think that was the month of February. And Ray and I do have like a 12-month trend in front of us. Because that's important, because what you'll see is that trend on the operating margin going down from the months of February and moving forward. That is a piece of it, the supplemental that we received, but also there was a lot of efforting into reducing our expenses and our cost. So cost control, I think in February or March, we talked a lot about ending contracts, reducing contracts, looking at other opportunities. In the Finance Committee meeting today, we had 2 contracts that came forward. One, it was all about cost savings. The second one was about servicing the equipment that we have. So we continue on that path. As a result of some of the changes that we've made as it relates to cost control, you're seeing the downward trend benefit in terms of outcomes from some of those changes. Next month, we are preparing to come forward to the board committee to talk specifically to the things that we did to drive some of the changes that you're seeing the benefit of in our income statement. And so while we don't have like the full complement of the 26, I can tell you 9 million of that is related to the supplemental piece that we received. And the other components are merely operational efficiency gains through a period of time from February to this most recent close period, which was month end June and year end for us. Yeah. You're welcome. I'll stay here.
May I ask an additional question about the income statement? Just to, it's the comment that we missed by $11 million the budget for lease and utilities because the budget didn't include the Meharry lease, which I understand is approximately $8 million. So, but backward looking and forward looking, just in due diligence, how did we not account for the fact that we have an $8 million lease with Meharry, and that wasn't in the budget? Do we know that? And secondly, have we fixed it going forward? We have now accounted for the fact that we have an $8 million lease for the next fiscal year, right? And that is in our budget just to make sure we don't miss it again.
Yeah, I'll start. I guess that is a great question. I've asked those questions. Why it wasn't in the budget is honestly I don't know that question because there's no documentation of it. So as far as this year, because it's an in and an out, if you will, because we receive revenue from it, it's a net of zero, if you will. But that doesn't mean it shouldn't be in the budget. So I'm researching that right now.
Okay.
If I may, I just because I know Ray is new to the organization, I think you asked a really great question that we have kind of been asking ourselves as well, as how did we come to term, how do we do budgeting before? And so if you have an $8 million lease, typically that would be spread across the 12 periods. And so we haven't seen that here. And so, one of the things that I think KPMG has been diligent in Dr. Blackledge's leadership is fixing those problems in finance, which I think we all know have been pervasive for many years, quite frankly. And so we're getting there. I think they're doing diligent work in doing that, but we have those same questions. So you're, asking us why it wasn't in the budget. We're asking too. And so they're doing that and operationalizing the tools that KPMG is putting in place, and we'll be in much better shape post August.
Right, and I'll close that piece out too with the question. You're absolutely right. I go back to February. I go back to having to stand up and share. We need to do something different. I go back to even after that end-month board meeting, having private meetings to say we need to do something different. And so where we are is we're doing that something different. And we're operationalizing those tools. Actually, this month of August, many will be operationalized. But when we look at this, we have to recognize the expense for our lease in some category. And at the end of the day, that is one of the most important factors. Everything that comes in has to be recognized, and everything that goes out must be recognized. And this is our attempt to ensure that we're doing it. Yes, we should see the flow across a period of 12 months. We do not see that today, but we have recognized that at this month-end period.
What period of time is this $8 million for the lease? Is that?
It was amendment number 3. Am I correct? Okay, because
what period of time will it cover?
It would be this most recent.
Yes, most recent fiscal year.
Correct.
For the past fiscal year.
Correct.
This most recent.
Wow.
Correct.
So, and now will we start paying it monthly, or?
We won't be paying it monthly, but we will be accruing the cost monthly and the revenue as well.
Well, I appreciate that very much, and I don't mean to imply by my question that it's you all's fault.
No.
But let me offer the encouragement that what we were talking about, I think, is a historical problem, and the fact that $8 million in lease payments were not accounted for is such a large problem. And as encouragement, I mean, I have the utmost confidence in the changes that you all are making, have really appreciated as a board member, knowing that you are really diligent about that. And so I thank you, and I appreciate your work on that, and just mean to highlight that it's so important, because a miss like that is just devastating to the organization. And so thank you for your attentiveness to do that.
And we appreciate your comments, and we recognize and understand that we're not saying, fault here or receiving it as fault. We are forward moving, we're forward thinking, and we are putting the right tools in place to do the things that we need to do to run the organization and be of good financial stewards.
Thank you for that. I have one now, just sort of factual question to catch up on something that had been a recurring part of the financial presentations, which was the discrepancy between what we expected and what we were getting from the additional state funding line. And throughout the fiscal year, we were looked to be, close to $10 million behind on additional state funding. And as I recall, we were not sure what was going to happen. It depended on the legislature's allocation. There was some open-ended question, and it looks like in the month of June, we caught up and we were exactly on budget. Can you explain how that happened?
Happy to explain that. Great question. I'll start and I'll let Ray finish. So there are two programs. One is the hospital investment program, or is a hospital improvement, but it's the HIP program. So it's hospital investment, hospital improvement. So through that program, I believe there was $3.7 million. Ray can clarify the dollars associated. So we received the payment in increments, right? And that was part of the state funding piece where they changed the payment methodology that bled over into this current fiscal year. However, we received like 3.7 or some odd amount that we had to go, because we received it during the month of June. We recognized it, receiving that during the month of June. The additional payments will come in this fiscal year that we just jumped over into, the FY 2026. There may have been some other state payments from the PHSPP. There's another program. Those payments may come in, and I'll toss it over to Ray if you want to add or talk about how we close that out.
Yeah, no, I mean those are all the funding pieces. Something I have a whiteboard in my office, and I have it all over there to understand the matching and the payments, and then the timing of all those payments. So I'm still learning that myself, but it is something that the funding piece, it's certain pieces have come in when we weren't expecting them, and some of them we're waiting on. So a lot of this is the timing piece, part of it too. So but we're still learning about that. The PHSPP part, which represents the part of our main funding, is in process, and we expect to get that in a couple of weeks, 2 to 4 weeks.
Right. And there's one other piece. I will share that from the HIP program, we actually are receiving more than we anticipated because it rolled into the new year, a different year. Yeah. So, all good news.
Yeah, thank you. No, that is good news, and just very helpful to understand, why it is that we caught up. But I'm very glad that we caught up.
Yeah, and let me just reiterate too a little bit about with KPMG. And I know that's been talked about. That is such a huge deal right now for the organization, and I fully embrace that their presence and their involvement, and they're a little over halfway done with their project, and that's going to be really big. I talked about last month about a culture of discipline, and we are really working on that. That is really important, and that's for situations just like this. We're going to know the whys behind the numbers. We're going to be prepared with notes going forward, and so things will continually improve, and that's, yeah.
So I'll echo David's comments about how great it is to see some of these things being corrected, and about our confidence in how this is going to be done in the future. And just one other question about the additional state funding. I mean, it looks like for the year, as he said, actual and budget are almost exactly there, and yet we still have a report of a $9 million variance, which must not be correct.
That is not accurate. We noted that yesterday.
And so, I mean, this falls all the way to the bottom line, right?
No, it doesn't.
It does not.
It doesn't.
It was manually corrected, and most of them, yours must not have gotten the correct. It's actually 375,143, but yeah, we apologize for that. But if you look at the subtotal there on the total net, that $9 million's not included in that.
Thank you.
Apologize for that. And then just one other point on the financials. Again, we can have whatever questions you have, but on the balance sheet, if you notice on the accounts payable line, about midway down, accounts payable $17,244,000. That is that's obviously a big factor in kind of how we operate as an organization. It certainly impacts the finance team, but it definitely impacts the whole organization. It is such a huge deal and difficult for the hospital to operate under $17 million of debt. It's just a reality. It's not a complaint. It's just we meet every day to review payables. You know, what is the largest crisis we have in the hospital, then we need to cover. We meet every day. You don't normally have daily check runs, but we are trying to get the AP straight and be able to manage that. But that's probably the most difficult. Not probably. It is the most difficult part of managing a finance team is having that kind of scenario. But just trying to be transparent there about that.
Is there a light at the end of the tunnel there? I mean, how you get your, is it revenue? Revenue would help with a high accounts payable, but is there a way to reduce the accounts payable? What's the?
Yeah, it's going down. We're obviously focusing on the over 90-day buckets and kind of working our way down, and it is getting better. Will we be able to make up $17 million in a year under current operations? No. So something has to change, and that's what revenue pieces we're looking at. We obviously need to enhance our revenues where we can, and there's some specific things. I don't know if you want to talk about those, the revenue.
Right. So no, I won't get into the specific details, but we have committed to bringing that back next month, along with what we did to get us to where we are. So our commitment to this organization from February to now has been, and we'll continue to echo it. 1, we've got to get the costs under control. 2, we've got to get staffing levels right. 3, we got to work on revenue growth. We're at the point that we're focused on revenue growth. There are some things in the pipeline that we want to absolutely execute on, and we have plans with some target dates that are not finalized there for us to execute on. So we'll be bringing those plans back. But part of that is we must grow revenue. We've said this, and we've also said we must deal with the marketing side and the public relations piece that we have had to acknowledge over the past several months. Right. So along with those things and focusing on the infrastructure, which means how we do the work that we do every day, how our patients get seen, how they enter into the facility. We've spoken about a digital front door. So there are multiple parts and pieces to that plan, and we just need to bring that plan back next month as we plan. But the revenue clearly is one of the most important parts that we have left from that piece of it.
I want to make a comment. Our original plan was to bring you all kind of a 90-day look back. What have we done in the last 90 days at this board meeting? But you raised a good question. How come we didn't have a budgeting process that included the $8 million? So Dr. Blackledge and I wanted to ensure the KPMG project was complete, that the financial infrastructure was in place, that what we report to you is accurate prior to providing you a report of all the things that we feel like we did without ensuring our financials were in the best shape. and that's why we delayed that report to the next board meeting. Thank you.
Are there any other questions, Madam Chair? All right. Thank you.
Thank you. And I do know they're working hard. I mean, there's, just to state that there's a couple items that have come up in terms of on the AP side that weren't even in the system. So when you get an invoice that says you owe $1 million and you didn't know it was there, that's a problem. So, you know, they're working through this. Those are these lovely little eggs that they have to, you know, that pop up and they find them, and they're not a good Easter egg. So they are working through them. They do pop up, but they're having to manage these. So that's, I'm proud of the group that's working through these. I know it can be frustrating, and day to day you find these surprises, but we're almost there. We're almost there, and we have the right team to get there. So,
just a brief comment too. We have to recognize that there are some very positive things that happen, such as a drop in denials, and so that is very important. And that adds to that, you know, and finding certain mechanisms and ways in which to identify something, eliminate or increase or change or what have you. So those things are happening in real time. And so kudos, and that's important.
thank you. Now on to contracts. The first contract up is the Fuji Film contract. Our finance committee met, went through both of these contracts. I'll briefly summarize, allow our board to ask any questions, and then we will move to the approval process. So first up is the Fuji Film contract. Dr. Brown brought this contract to us. It is a maintenance service agreement, 2 years, and just a cost of annually of $36,000. So this is just a non-medical services contract for the equipment that's needed in the radiology department. So any questions about this contract?
Is that a contract that covers the hospital and Bordeaux, or?
Dr. Brown?
Bordeaux. Just Bordeaux? Yes. And then the second question is there very good utilization of the Bordeaux facility now and the radiology equipment?
Yes, sir. I plan on providing a report on what we're doing up there. It's increasing as we get payers lined up. We signed off on 3 other payers, so we're just about where we need to be with our payers as far as receiving patients. And so I think we're doing a great job up there at Bordeaux with the imaging center.
Any estimate of this is CT and MRI, right?
This CT, MR, ultrasound, echo, X-ray, and mammography.
Okay. Yeah, I mean, I think it would be good to see a trend of.
Yes, I'll get you that.
Of that maybe next meeting.
Okay.
Great. Any other questions? And Dr. Miller, as part of the CEO performance review, I think your point's well taken. You know, let's make sure that what we do have in place as well is working and generating revenue for us. And I know Dr. Elders has been focusing on each of those areas, each clinic, each process, and starting to look too at the technology to make sure it's a return on investments, whether it's robotics or and we're moving forward in positive ways in some of the other areas that have been a deficiency and a kind of a drag on the balance sheet. Any further discussion? If not, I'll entertain a motion to approve the Fujifilm contract.
Moved.
Is there a second? Any discussion? All in favor? Aye. Motion passes. Second contract is the GEBBS Healthcare Solutions contract brought to us by Dr. Blackledge. This is a 1-year contract with an auto renewal. My favorite thing about this contract is that it is going to save us $44,000 a month, which equates to about $500,000. And so that's pretty exciting. And just wanted to allow Dr. Blackledge, do you have any other comments about this contract that you'd like to add?
No additional comments, Madam Chair. We have no additional comments. Is offshoring, onshoring, comparative analysis, is moving forward with cost reduction opportunities that don't change our quality or the patient experience.
I mean, that is a huge change in cost for this service. Do they have a good track record?
Yes, they do have a good track record, and we are utilizing them in some of the areas today. So this is an expanded service line.
Any more questions? All right. Seeing none, I will entertain a motion to approve the GEBBS Healthcare Solutions contract. Is there a second? Any discussion? All in favor? Aye. Motion passes. Great. All right. Thank you. Dr. Elders, Interim CEO report.
Good afternoon. You do have a report in your packet. I will not be reading it to you verbatim. I do want to highlight, we did put a little, happy story that was written by our nurse manager in the emergency department about one of our homeless initiatives here. And so the KPMG operational optimization work stream 1, which we've talked about today, is on schedule for the end of August. As stated, they are working on tools and deliverables. The KPMG work stream 2, which is really around our workplace efficiency, we are on schedule for that to be completed by August, and we'll be reporting out to the board some initiatives that we'll be putting in place post that completion of that work stream. We do have a chief retreat that we'll be doing on August the 7th to kind of address some pervasive issues around organizational culture and operational efficiency. We did already give a PSA update. For Metro Internal Audit, the lead investigator did meet with Christy Lewis and I on Friday the 25th. And all of our outstanding compliance items and items that needed remediation have been remediated at this time. The last item that we had really was the legal representation for the overpaid funds to City Valet, which we have secured representation from Baker and Donaldson for that engagement. There are a number of capital repairs that are challenges that are listed in the report. I do want to thank our board chair, Christy, and Metro Finance for collaborating with us on those, and we have a plan in place to address them now at this time. This report was written and handed in earlier in the month, and so those things weren't, completed at that time, but we do have a plan to address that $2.1 million in urgent capital needs. Our compensation review that was requested, there were 5 proposals provided to us. We have gone with one HMS Valuation Partners, which was, of course, recommended by our law firm. All of these were provided by the law firm for us to vet for this compensation study and succession plan and review. And we are looking at a presentation to the board by the September board meeting. That is our timeline on that, and if that changes, I will let the board know. Other than that, let me make sure. I do, on behalf of the leadership team, just want to thank the board for the new path forward. We, as an organization, feel like it's really needed. We're really happy about the way we are headed as an organization. I think if you walk around the halls of the hospital, it feels like a different environment, and so we owe thanks to all of your hard work for changing that for us. And so on behalf of the leadership team and the staff here at Nashville General, thank you to you all. That's the end of my report.
Thank you.
Dr. Elders, you've identified and brought to our attention some really critical needs for capital. And could you tell us how we move forward with this? I know that it's a little different from getting budget approval. I think the mayor has a bigger role in capital allotment, and if I'm not mistaken, we went 1 year without making any requests, and therefore didn't get anything. How are we going to
Sure, absolutely.
move forward on this year?
And so I will say our board chair, our new board chair, Christy, has been in communication with Metro and Metro Finance, and they have been in communication with our team about a plan to move forward. I can't disclose exactly what that looks like right now, but we have been assured for this piece, these pieces that are listed publicly in this report, our HVAC system and our security needs and the mattresses, that we will be getting those taken care of. And so I'm working with the facilities team on the HVAC repairs and a plan on when we can start that. As you all see, it's a little warm in here. And so we are working on that. The exact where we're getting the money from, I can't disclose just at this time because I don't know, but we have been assured to start kind of work. These are urgent. And then we'll keep working with Metro Finance and our board chair. And I'll say even Metro Procurement, we've reached out to them about some synergies that we can gain just from being one Metro, kind of entity. And so that's our plan for moving forward, sir.
Well, I know all of us board members would be happy to know any way that we can lobby the mayor's office, the council. Please let us know how we can help in this process.
Dr. Elders, thank you for that report and the work you and your staff are doing. You mentioned the atmosphere. I walked around on the 5th and 6th floors on Friday, and it's upbeat. Everybody on the staff, doctors, nurses, techs, the folks who clean up, we're all saying positive things about the passion they have for serving the population that we serve here. But I would also say on a broader scale, some of the things you just mentioned and some of the things that have been mentioned throughout this session today really get to the core of the improvement in relationships, the relationships that we have with the city, the relationships we have with Metro, the relationships we have with Meharry, the relationships we have here at the board and with the executive leadership team and others here at the hospital. And sometimes that's taken for granted. Of course, the work has to be done, the kind of work that we heard about in finance, the investigation into the details, but the relationships are critical. And when that relationship on various levels is improved, then there's more of a willingness for people to work together, to see the light of day rather than looking at negatives all the time. And there is certainly a lot to be worked on here. There's so much to be worked on every single day, and compliments to you and the staff for working on those things. But it is at its essence, improvement in relationships, people being able, I want to say that I sat in on the town hall meeting that you had on Tuesday with the staff here. And to hear the number of questions was great because it felt like people wanted to be able to ask questions, but it was equally important to hear your responses, which were honest and transparent. And from my perspective on the board, it is just an incredible turnaround in how things are in this building. Thank you.
All right. I'm last. We did a little swap on the agenda, so I'll wind up for today. just to say that I appreciate everyone here, all of you that come and support and are part of the process. And you don't always speak, but you're here and you listen and you take it out, take all this in. And I would echo everything that has been said here. The relationships with the mayor's office and Metro Council and Meharry and, for me, each of these board members, I mean, it is a unbelievable turnaround since I've been here. It's been, two and a half years, I think. And just the excitement and engagement that is happening. So I've really, really high hopes about where we're headed. My ultimate ask, though, is tell others. We're out in the community, and I ran into a prior board member getting groceries the other day, and I, was telling them how excited I was about and what's going on, and they had actually heard, and they said, "Well, I'm really happy for you," and I said, "Well, basically, but you're not on the board anymore." But I mean, it's just, I'm really excited about where we're headed. And so, if you're at a Little League game and you have an opportunity to talk to other parents about how great NGH is, if you were at a cocktail party, if you're at a sorority function, talk about what we're doing. I mean, if you're at church, talk about what we're doing. So we are the best beacon for all the changes going on here. So I'm excited to be able to do that with each of you. Lastly, I would like to say, speaking of thank yous, I'd like to say a thank you to Dr. Martin, so my friend Buzz, for his service December through June. I cannot imagine being asked to do the job that you did during those 7 months. And what an amazing and also awful experience to go through, but in a very short amount of time. So you had a change in a CEO, you've had change in a lot of us as board members, you dealt with the media, you dealt with needing subsidies, a reduction in leadership team, a reduction in staff. I mean, just dealt with so many things in such a small amount of time. And I just want to thank you so much for helping pave the way to where we are now, and appreciate you as a friend. So thank you. All right, now so we can all get to work. We have our committee assignments. Each of them have many. We will have our next board meeting on Thursday, August the 8th. And with that, I'll take a motion to adjourn. Thank you. Oh, I'm sorry. August, what? 28th. Did I say 20th? You said 8th. I know, 28th. Oh, no. 8 days from now. We can't do that. Ladies and gentlemen, I'll be on vacation. I won't be here on I'm taking my family. We'll be at the beach. Make that the 28th. Thank you so much. Thank you.